part because of the murders in Charleston, South Carolina. Holding that and knowing that we all come this morning with that heavy on our hearts. So this is part of a poem by Maya Angelou called A Brave and Startling Truth. We, this people, on a small and lonely planet, traveling through casual space, to a destination where all signs tell us it is possible and imperative that we learn a brave and startling truth. And when we come to it, to the day of peacemaking, when we release our fingers from fists of hostility and allow the pure air to cool our palms, when we come to it, when the curtain falls on the minstrel show of hate and faces sooted with scorn are scrubbed clean, when the rapacious storming of the churches, the screaming racket in the temples have ceased, when we come to it, when we let the rifles fall from our shoulders and children dress their dolls in flags of truce, when landmines of death have been removed and the aged can walk into evenings of peace. We, this people, on this small and drifting planet, whose hands can strike with such abandon that in a twinkling life is sapped from the living. Yet those same hands can touch with such healing, irresistible tenderness. Out of such chaos, of such contradiction, we learn that we are neither devils nor divines. When we come to it, we, this people, on this wayward floating body, created on this earth, of this earth, have the power to fashion for this earth a climate where every man and every woman can live freely without crippling fear. When we come to it, we must confess that we are the possible. We are the miraculous, the wonder of this world. That is when and only when we come to it. Amen.
Amen. Kohayam, Kadamika, Kanamika Tilakam, and Gunash Chish. I wanted to begin this morning in my language and actually borrowing some of the language from the Chinook Nation, which is the community and sovereign nation whose land we're on today. And the words I share with you essentially welcome and greet and acknowledge you as my relatives and extended relatives, and thank you for being with me today. I also want to take a moment this morning to acknowledge and appreciate and honor all of the fathers in the room and all of the people in the room who support fathers to be great fathers. So thank you for all that you do for your families and for our extended community. So as you heard, I have the honor and privilege of serving as the president of Northwest Health Foundation, and we are a unique organization, quite unlike almost any other philanthropic institution in our region, and that's been a journey for us. And so today I want to tell you a little bit about who we are, our broad vision of health, our decision to partner differently with the community, and how we've decided to invest our resources in an attempt to make our region more healthy and in an attempt to ensure that the most vulnerable voices are at every table taking part in creating a preferred future for all of us. So Northwest Health Foundation is about 20 years old, and we began quite similarly to most health foundations, making responsive grants. We invested in some really fabulous ambulances and some medical equipment. We even dabbled a little bit in funding some electronic medical records, and certainly those are really important things. But what we found was that while that was important and we learned a lot of lessons about how to do that in a wise way, we actually found that after years of making investments in the healthcare setting, that people's health actually hadn't improved. And in fact, our region's health had gotten worse. And when you're a health foundation and you're making investments and your sole mission is to improve health, and your strategy's not working, you have to take a moment and think a little bit about what you're doing and why you're doing it. And that's what we did. And we started by really thinking about our definition of health. And where we landed was really on a quite broad definition. And we included mental, spiritual, physical, and social. And in the beginning, we were great at saying those words, but we still pretty much just focused on physical health. And that's actually what you'll find most of the time when folks have a broader definition. It's very seductive to only focus on the physical because it's very concrete. But what we found is that when we looked at the research and when we talked to communities, as easy as it is to focus on a clinical setting, what we actually found is that almost all of the research will tell you that if you want to improve the quality of someone's health, and if you want to increase the length of someone's life, and if you want fantastic health outcomes, spiritual and social are actually two of the most incredibly important quadrants. And that if individuals feel connected to a higher power, if they feel connected to their community, and they feel like there are people in the world that care about them, that they're accountable to, their overall experience in life, quality of life, and health can improve in some significant and incredible ways. The other thing that we found is that we live in a state and a region that is unfortunately very unequal. And when you look at the health outcomes of low-income folks, communities of color, people with lived experience with disability, you see deep, deep disparities in the way they experience health. And that while it's troubling and difficult and sometimes uncomfortable to talk about it, what we discovered was that those communities actually represent the most profound and greatest opportunity. And that if you can impact the health outcomes of those communities, you actually can significantly shift all of our outcomes in our entire region. And so the very communities who are often described as most challenging, hard to reach, sort of fill in the blank, actually hold all of our future and our overall health and well-being in their hands. And yet they're the very communities who are often least engaged in a conversation about how to improve health outcomes. And so as we looked around and reviewed the data and the research, we saw a couple of things. When you look at health outcomes, there's a couple of really important factors that really shape the lifelong outcomes. And they're really different than what most people think they are. They're not access to health insurance. They're not about your proximity to a hospital. They actually have to do with your mother's experience before she got pregnant with you and while she's pregnant with you, your race, your zip code, your exposure to child abuse and neglect, the likelihood that you'll graduate high school, and your larger connection to a community. That could be a community center, a faith community, or being part of an extended family where you feel loved and welcome. Those are the most important things. And so we looked at that and said, well, we don't want to change anyone's race. We want people to feel incredibly proud and excited about who they are. And we don't want folks who have a lived experience with disability to have any perception that they can't be healthy. So what are the things that we can change? We're not going to move people out of their neighborhoods. We might be able to support certain zip codes to be healthier and have better access and better resources. So what can we change? And while there's a lot of talk about early childhood and a lot of talk about investing in children, when you actually look at where dollars are spent and resources go, it's our population that really has the least amount of lobbyists in Salem, the least amount of advocates. And then when you look at dollars invested at the federal, the state, and the county level, it's the percentage of the population that has the least amount of dollars invested. And so we thought, well, we might be able to do something to impact early life and children's chances of being born into a healthy, thriving, vibrant community. And we said, well, if we looked at that, and then we thought about how we could impact the communities who really represent the greatest opportunity, that's where we might be the best partner. And then we looked and said, well, let's see how others have done in this type of work. Let's go to some meetings and let's see what's happening, and let's think and talk about who our children are in this state. It was very interesting. So when you look at school-age population in the state of Oregon, 38% of all children in kindergarten through 12th grade are from communities of color. And the 6 most diverse counties are actually rural communities. Mulhern County, for example, Jefferson County. Multnomah County is 7th or 8th, actually. And so 38% is a little bit more than most people think. And then we looked at the 0 to 5 population across our state. And we said, wow, that population has been majority-minority since 2011. That's interesting. When you look at all of the meetings that we go to where folks are making decisions and deciding policy about what early childhood looks like, when you go to any education discussion, it doesn't look at all like the kids that are in our schools, that are in our early childhood programs. And in fact, we've been making the same investments and the same mistakes for about 100 years and wondering why the solutions that we keep proposing don't work. And I'll just pick on my own field, for example, public health. We go to a lot of those meetings at Northwest Health Foundation. I'm a card-carrying public health nerd. And it's rare that I go to a meeting setting policy for children and families in the state where 95 to 98% of them are not from white, middle, or upper income backgrounds, making policy decisions for very low income families, a large percentage of whom are rural, and an even larger percentage who are from communities of color with very different cultures as the folks in the room. Now, I truly believe that every person has an important role to play and can be an ally. And I also truly believe that we are not experts in everything, and that if you're getting abysmal outcomes, which we are in the state of Oregon, in the field of early childhood and education, that we need to do something different. And that we may need to invite different people to the room. And so at Northwest Health Foundation, we said, the way that we want to make a contribution is to invest and to support and partner in getting different people in the room to help make those policy and advocacy decisions. And our theory of change is that if different people are in the room, bringing their vision, their perspective, and their voice, we will get different outcomes because we will have different policies. Policy advocacy is great, but who sets the policy and who articulates that vision is really important. Now, most people agree with me on this, but it's a little bit tricky to imagine what does that actually look like. So I've been trying to think of an example, and I'm going to try it out on you all. So I happen to be of Native American heritage. I'm also half Irish. And I was thinking about what it would look like if you got the 12 leading Native American experts in a room to decide an early childhood program for, let's say, the African immigrant and refugee community. Now, we would do our research. We would try our best. We'd probably do some focus groups and interview some leaders and stakeholders. And we would be very well-intentioned, I would assume. And yet, I bet our program would not be as effective as if you really, truly engaged that community to decide what they wanted for themselves and how they wanted it. And so, where people can hear that and say, yeah, that makes sense, and yet, day after day, policy table after policy table, we don't do the same thing across our state. And as a result, we have some of the fewest investments in early childhood. And when you look at the children who are served in early childhood and get access to resources in that field, the children who are from the poorest communities, most rural communities, and most diverse communities are least likely to have those opportunities. And I don't think that's the preferred reality that any of us want if we're really truly going to reach the outcomes that we all want for our state. So if I could leave you with anything today, I would just share that there is such a tremendous opportunity, and some of the most important communities and voices that need to be heard in policy advocacy are our nonprofit communities and our faith communities. And I think that there's a myth that is put out there and reinforced time and time again that that's not an appropriate role of the faith community, or that it's somehow not legal or appropriate. And if I could leave with you today the message about how important your voice is in any policy discussion or advocacy effort. And actually, when you look at any of the most important environmental policies that have been set in the last 50 years, health policies, educational policies, in every single one of those examples, maybe you all can find one that contradicts this. I've yet to find one. It has always been a partnership between the faith community, communities of color, and nonprofit organizations really coming together and providing voice for the most vulnerable people. And so if I could invite you and encourage you to think about the power and the resources and the important allies that you all can be in this room. I don't even care what policy or advocacy issue it is. I would just say that you have an important voice, and it's such an important part of our community to have it shared and to think about your role as a partner to be that voice for vulnerable people. Thank you very much for having me, and thank you for listening to my thoughts. And it's an honor to share this beautiful day with you and to be with you on Father's Day.